Hi, good evening. Am I visible and audible, guys? Please give me a thumbs up so that I know. Hi, good evening. Welcome to this YouTube live session at Unacademy. So today we would see about the tricks to remember. YouTube live session. So today we would see about the tricks to remember monoclonal antibodies. So first of all, welcome to our family of Unacademy, whose goal and mission is to help you crack NEET PG. So let's crack it, especially with our mnemonics and tricks that we would be discussing here. So monoclonal antibodies. So monoclonal antibodies is a very important topic. Many of you find it very confusing to remember. So I have found these tricks, I have discovered these tricks to share with you. So let me tell you some tricks. The questions which I am sharing here are the ones which have been asked in the previous exam, especially the NBE exams. Okay. So let us start our today's session. So first of all, the question is fully humanized antibodies. Fully humanized antibodies used in treatment of rheumatoid arthritis. Yes, people? Can someone answer this question? Yes, what do you think is the answer to this? Fully humanized antibody used in treatment of rheumatoid arthritis? No, it's not Anakendra Nandini, it's not Anakendra Danish. This is a very easy question. People, even if you have not read this, you should be able to answer this. I'll tell you the trick for it. So, when you have antibodies, monoclonal antibodies, there can be 4 groups. Okay. Either it could be a chimeric antibody, it could be a humanized antibody, it could be a fully human antibody, or it could be a murine or a mouse antibody. Murine or a mouse antibody. So in the name of the antibody itself, you have clues to identify what group does it belong to. So when it is a chimeric antibody, so remember in the name it will have XI. Okay, in the name it will have XI. Like when we say Infliximab. When you say Infliximab, XI tells you that it is chimeric. So remember, XI is like your CHI, that is chimeric. So CHI is nothing but XI. So chimeric is XI. So rituximab, again XI would be chimeric. Humanized antibody means it is just 95% human. It is not fully human. So humanized is 95% human. So in that, in the name of the antibody, humanized, so Z, so you will have ZU. Okay, you will have ZU. Example, trastuzumab. So when you say trastuzumab, ZU tells you that it is humanized. It is not chimeric, it is not fully human, it is not murine. It is a humanized. So from humanized Z, remember ZU. Fully human antibody. Okay, fully human antibody. So fully human antibody, it will be MU. It will be MU or only U. So example, when you say adalimumab. Okay. So when you say adalimumab, so MU tells you that this is a fully human antibody. Okay. Like denosumab. So you have only U, so it is a human antibody. That's the key. For the murine or mouse, so mouse is MO. So you will have MO in the name, in the term of antibody. So when you say ibritumomab, okay. So when you say ibritumomab, MO, mouse, that tells you that it's a murine or a mouse antibody. So very easy. MAB tells you that it is monoclonal antibody. The prefix adjacent to MAB, XI, ZU, MU, U or MO tells you that what antibody is it. So now I think you can answer this question. Fully humanized antibody used in treatment of rheumatoid arthritis. So yes, now the answer will be adalimumab. Don't get confused here कि fully humanized बोला है तो ZU आना चाहिए. When you say fully humanized means that it is a human antibody. Okay, humanized is only 95% human. Fully humanized means human, means it should have mu, and that is why the answer is adalimumab. So even if you have not read this, you should be able to answer this question. I hope this is clear. Okay, what will be the type of infliximab? Infliximab will be what type of antibody here? Which group? Yes, it will be chimeric because it is XI. How about anakinra? How about anakinra? Anakinra is against which? It acts, what is the target for anakinra? Can somebody tell me the target for anakinra? Yes, we use it in rheumatoid arthritis. Very good, it is interleukin 1. Very good, it is interleukin 1. Now what tells you that it is against, the target is interleukin? What helps you to remember that? So when you have Ki in the term of the drug, so Ki is actually interleukin. So the drugs against interleukin, okay, Ki will be there in the name. So like you have ustekinumab, which is against interleukin. Okay, it is against interleukin 12 and 23, and it is used in psoriasis. Correct. So that tells you that this is against interleukin. So very important point. Please remember about this. Now, next question. All of the following are true about infliximab except. Yes, it is used in Crohn's disease. So when you get such questions with long options, the trick is read all the options. Okay, do not jump to the answer first. Read all the 4 options, then come to the answer. It is used in Crohn's disease. It can cause reactivation of latent tuberculosis. It is given intravenously, and it is a fully humanized antibody against TNF alpha. So yes, tell me what would be the answer to this? Yes, very good, Dinesh. The answer would be D. Yes, Salma, the answer would be D, because we know that infliximab XI is a chimeric antibody. So when you know this, you need not worry about rest of the options. You are sure that the answer is this because you know that it's a chimeric antibody. So whether it is used in Crohn's or not, whether it causes reactivation or not, whether it is given intravenously, subcutaneously, orally, does not really matter when you know that this is the incorrect statement. So that is the trick here. One of the important tricks to score more. Read all the options. When you know that this is the answer, do not worry about rest of the 3 options. Correct? So important points about infliximab. Tell me the target for infliximab. It is monoclonal antibody against. Yes. Infliximab is a monoclonal antibody against what? What is the target for infliximab? Very good. It is TNF alpha. It is TNF alpha. How do you remember this? Very easy. Infliximab is INF, that is TNF. Okay. So it is against TNF alpha. So TNF alpha, inflammatory role, used in Crohn's disease. It is used in rheumatoid arthritis. Anything, so it can cause reactivation of latent tuberculosis. Yes, all your TNF alpha monoclonal antibodies drugs can cause reactivation of latent TB. It is given intravenously. Very true. Unlike other TNF alpha drugs which are given subcutaneously. Which are the other TNF alpha? Which are the other TNF alpha drugs? Okay, so to remember that, remember the mnemonic for TNF alpha. इटली की अदालत में सर्टिफिकेट देके इंसाफ होता है. What do we mean by that? So you have इटली की अदालत में सर्टिफिकेट देके इंसाफ होता है. ठीक है. So इटली means etanercept. अदालत means adalimumab. Certificate means certolizumab. Do not get confused with cetuximab. It is certolizumab. It is not cetuximab. That is why certificate. So it is certolizumab. Insaf matlab infliximab. Okay. So these are your drugs against TNF alpha: etanercept, adalimumab, certolizumab, and infliximab. Remember that. Coming to the next question, now you've read this much about infliximab, but suddenly you get this question in your exam hall. How do you crack this question? Infliximab is IgG1 chimeric antibody, fully human antibody, IgG4 chimeric antibody, or a receptor fusion protein. Okay, so start ruling out the options based on the knowledge that you have. First option you rule out is option B, because it is not a fully human antibody. We know that it is a chimeric antibody. So answer has to be either A, chimeric antibody, or it has to be C. It is not a receptor fusion protein. It is a monoclonal antibody. So D is also ruled out. So now you are confused between whether is it a IgG1 chimeric against TNF alpha, or is it a IgG4 chimeric against TNF alpha. The trick that you can use, which works most of the time here, is look at the options. The other option which we ruled out, it is IgG1 fully human monoclonal antibody. So when you have two options which have the same terminology like IgG1, that is the one which is generally the correct answer. So in between the two options, IgG1 chimeric and IgG4 chimeric, the answer that you should choose in your exam is IgG1, because the other option also says IgG1, correct? So the answer is this. This is how you do logical guessing in the exam. Okay, so when you say that you have ruled out two options but you don't know the answer between the two, look at the other options. Ones which have the same terminology is likely the one which is the correct answer. So the answer is, it is IgG1 chimeric antibody against TNF alpha, correct? Next question. All of the following are used in Crohn's disease except, yes? Can someone answer this question for me? All of the following are used in Crohn's disease except infliximab, certolizumab, etanercept, abcizimab. Yes, it is D. Very good, it is D. Yes, Danish, Nandini, it is D. So we have already seen that these are all TNF alpha drugs. Even if there was some other option in this options, you should rule out abcizimab. Why? Because the term abcizimab, when you have CI in the term of the monoclonal antibody, CI tells you that it is used for cardiovascular system. Okay, so it is used for cardiovascular system, that is, it is used in patients of angina or post intervention to prevent ischemia. Okay, so it is a cardiovascular drug. Crohn's is not a cardiovascular disease, so you will not use abcizimab for Crohn's. So you should remember these terminologies again. You will have in the spelling of monoclonal antibody CI, TU, VI. Okay, you will have LI and you will have KI. This will help you to remember where are they used. So as I said, abcizimab, CI is for cardiovascular. When you say TU, like trastuzumab, cetuximab, so TU stands for tumor. So these are used in some tumors or cancers. When you say VI, it is for virus. Like you say palivizumab, that is used against RSV. Okay, so RSV, virus, so palivizumab is used for virus. When I say LI, remember LI is for immune system. Okay, it is for immune system. You can remember from LI, basically LI like lymphoid, that is the immune system. So LI is lymphoid, that is the immune system. So when you say infliximab, okay, infliximab, it is against immune system, that is TNF alpha. Certolizumab, against it is immune system, correct? So that helps you to remember. We have already seen KI is the one which is against interleukin. Okay, KI is for interleukin. We've already seen ustekinumab, which is used for psoriasis. It is against interleukin 12 and 23. So I hope this makes this clear that start ruling out the options. Abcizimab is cardiovascular, so it will not be used in Crohn's disease. This abcizimab, very frequently asked, is a monoclonal antibody against GP2B3A, which is responsible for platelet aggregation. Okay, and that is how it prevents ischemia. So GP2B3A, abcizimab, you can remember by the term spelling itself has A and B. Okay, The spelling itself has A and B, so it is used against 3A and 2B. So A and B is abscizumab. So abscizumab is against GP2B3A. Remember that. Next question. Denosumab is used in. Yes, can someone answer this question? Denosumab is used in. C. Very good. It is C. Giant cell tumor of bone. Again, the trick here is when I told you that CITUVI, remember the other point also that when for the drugs against bone, the monoclonal antibodies used against bone, they will have O, bone ka O in their name. So it will be O or OS. So like in denosumab, you have OS. So they will have OS or O in their term. So denosumab is a fully human antibody which is used in bone conditions like osteoporosis. It is used in bone metastasis, painful bone metastasis. Similarly, it will be used in giant cell tumor of bone. So it has been approved for giant cell tumor of bone. You can rule out breast cancer because it is not a bone condition. Transplant rejection ruled out. Crohn's ruled out. You know that denosumab is bone condition. So automatically the answer becomes giant cell tumor of bone. Yes, this denosumab is acting against your rank receptor. Okay, denosumab acts against rank receptor and it prevents osteoclast activation. So that is how it prevents the bone resorption and it is used in osteoporosis and bone metastasis. Correct? Next, yes, you should know this. All are TNF alpha antagonists used in rheumatoid arthritis except. What will be the answer? What will be the answer to this? All are TNF alpha antagonists except. Very good, Dinesh. Yes, Dr. Sukruti, very good. It is ifosfamide. We have already seen these are your TNF alpha antagonists. We've seen that Italy की अदालत में certificate देके इंसाफ. So etanercept, अदालत में adalimumab, certificate certolizumab, and you have insaf, that is Infliximab. So all these three are TNF alpha antagonists while ifosfamide is not. Okay. And which of these is given intravenously? Infliximab is I, so it is given intravenously. So remember, Infliximab is given IV, rest of them are given subcutaneously. All of them can cause reactivation of latent tuberculosis. Yes, very frequently asked question, repeated so many times. NTIgE monoclonal antibody used in bronchial asthma is. Yes, what is the answer to this? NTIgE monoclonal antibody used in bronchial asthma. Very good. It is omalizumab. Omalizumab. Again, very simple to remember. Okay. So omalizumab, Li means it will be against the immune system or the inflammatory system. So it will be against that. And in omalizumab, Ma helps you to remember that it is against mast cells. Mast cells, we know that what is the immunoglobulin? Immunoglobulin E. We have seen all the important one-liners about immunoglobulins in our one of the recent sessions. So we have this revision course which is going on at Unacademy Plus platform. For those who have not subscribed, you can subscribe to it and make the best of it. You can ask your friends who are already a member of this Unacademy Plus platform for the medical marathon and my Revise with Mentor series which is going on. We have discussed so many mnemonics like this. We have discussed 1 hour session on immunoglobulins. In that we had seen that immunoglobulin acts on mast cells. It is the immunoglobulin which has homocytotropism, helminthic infections, PK reaction. You can revise that from the session. So here omalizumab, Ma is mast cells is IgE. That is why anti-IgE is omalizumab. Please remember that. Mepolizumab is a monoclonal antibody against interleukin 5. Okay, remember that. Now rituximab is a monoclonal antibody against. Rituximab is a monoclonal antibody against. Yes. Very good, Adnan. It is CD20. It is CD20. So CD20, the monoclonal antibodies which you should remember. Remember 20-year-old ट्विन सिस्टर्स, जैसे सीता गीता रहते हैं, ठीक है, गीता और सीता, वैसे आपके होते हैं रितु और सीतू, ठीक है। रितु और सीतू दो ट्विन सिस्टर्स हैं जो कि 20 साल की हैं. So these are against your CD20. What do I mean by Ritu? So you have rituximab and you also have ibritumomab. Okay, so you have rituximab, ibritumomab. C2 कौन सा है? tocilizumab. Okay, so C2 कौन सा है? tocilizumab. So remember here that Ritu and C2. These are your 20-year-old twin sisters. They are against CD20. Okay, they are against CD20. Yes, next question. Rituximab is used in, where do we use rituximab? So these are examples of questions. Even if you have not read, you should be able to answer this. Let me tell you, in the exam hall, you will face questions like this. These will not be direct questions from whatever you have solved or from the previous years, but you can integrate everything and you can come to the answer. The topics will be repeated for sure. So rituximab is used in, yes, very good, Kiruba. Arpita, it is not Hodgkin's disease. It is non-Hodgkin's lymphoma. It is option C. Okay. Why it is non-Hodgkin's lymphoma? Arpita, you could have solved this question by remembering that we've already seen that rituximab is against CD20. CD20 is a marker for which cells? CD20 is a marker for which cells? Yes. CD20 is a marker for CD19, CD20, CD21 is a marker of which lymphocytes? Very good. It is B cells. It is for B lymphocyte. Correct? So it is for B lymphocyte. Again, we have seen all the CD markers from your CD1 to CD152 in our revision course. Please revise that. It's a very, very important topic. So you have CD20, which is for B cell. Okay. So B cell lymphocytes means it would be used in lymphoma. So it would not be used in AML. It would not be used in multiple myeloma. Then you have to know whether it is Hodgkin's lymphoma or non-Hodgkin's lymphoma. We know that the markers for Hodgkin's are CD15 and CD30. It is not CD20. So that is why the answer is non-Hodgkin's lymphoma, because it is not against CD15 or CD30. That is why the answer is non-Hodgkin's lymphoma. I hope this makes it clear. Okay. Next, the only FDA approved radioactive antibody that can be used for treatment of lymphoma. Yes. What is the answer to this? Which is the radioactive antibody? Yes, anybody can answer this question. Very good, Jaskiran Kaur. It is ibritumomab. It is ibritumomab. We already saw that ibritumomab is an antibody against CD20. Ritu or C2, 20 साल की twin sister CD20. So remember that IP helps you to remember that it is indium binding. Okay, it is indium binding, that is, it is a radio labeled antibody. So what you bind it with is either indium or more commonly yttrium. Okay, so you bind it with yttrium or you bind it with indium. So indium binding is your radioactive antibody. So remember, indium binding, that is IB. So that is Ibritu is your radioactive antibody. Trastuzumab is, what is the target for trastuzumab? Yes, it is directed against which receptor? It is directed against which receptor, trastuzumab? It is used in breast cancer, which is ER positive or PR positive or HER2 positive. Which cancers? Very good, Alvin. Very good, Danish. It is against HER2 receptor. It is against HER2. That is why it is used in breast cancer. It is used in breast cancer, which is HER2 positive. Okay. So how do you remember this? Trastuzumab is, remember, trastuzumab means, can you trust her? Okay. Can you trust her? Otherwise, she will break your heart. Okay. Otherwise, she will break your heart. So, trust is trastuzumab. Her is HER2. Heart is the side effect of trastuzumab. That means it can cause cardiomyopathy. it can cause cardiomyopathy. So previously asked NEET question, cardiomyopathy is caused by which monoclonal antibody? Trastuzumab. So remember, trastuzumab is, can you trust her? So HER2 receptor, otherwise she will break your heart. Heart means cardiomyopathy. And it is used in breast cancer. So when you write breast cancer, AST, that is trastuzumab. Okay. So trastuzumab is used in breast cancer. Remember that. Yes. We have already seen this. Etanercept used in rheumatoid arthritis act by the inhibition of TNF alpha. ठीक है. इटली की अदालत में सर्टिफिकेट देके इंसाफ. Those are your TNF alpha. Again, a previously asked question. Very important TNF alpha drugs. Yes. Recent question in AIMS as well. You had this in the match the following monoclonal antibodies. Bevacizumab acts by antagonism against. Yes, majority of you can make a mistake here. Let me see what do you answer this as. Bevacizumab acts by antagonism against. No, it is not CD1A. Paritosh, it is not interleukin 2. Not TNF alpha. Not interleukin 2. What is the answer? That is what as expected. Majority of you did make a mistake here. The answer is CD25. Okay, the answer is CD25. Why it is CD25? Don't make a mistake here that. First of all, remember that bevacizumab means it is a chimeric antibody. Okay. It has Li in its term. It has Li in its term. So, it will not be against a interleukin. इंटरल्यूकिन वाले जो ड्रग्स हैं उसमें KI आना चाहिए. So interleukin 2 is not the answer. TNF alpha drugs we have already seen. So bevacizumab is against interleukin 2 receptor. It is against interleukin 2 receptor. So you have interleukin 2 receptor on T cells and you have interleukin 2. This is the receptor. So the point is that bevacizumab acts here. It does not act on interleukin 2. It acts on interleukin 2 receptor, and CD25 is the alpha subunit of your interleukin 2. Okay, it is the alpha subunit of interleukin 2. So remember that CD25 is nothing but interleukin 2 receptor. So that is the other way of asking your interleukin 2 receptor. So remember, it is not interleukin 2. It is interleukin 2 receptor. How do we remember the drugs for interleukin 2 receptor? Which is the other drug apart from bevacizumab which acts on interleukin 2 receptor? Which is the other drug? Can someone tell me? bevacizumab के अलावा और कौन सा ड्रग है interleukin 2 पे जो एक्ट करता है? Very good. It is daclizumab. Very good. It is daclizumab. Okay. It is daclizumab. Now, how do you remember this? That it is daclizumab and bevacizumab. So remember that interleukin 2 receptor 2 means either we call it di or we call it bi. Okay. So it is bi or it is di. So when I say dimer or when I say binary, that means 2. So from di, we know it is daclizumab. From bi, we know that it is bevacizumab. And we know that di and bi are 2. So this is against interleukin 2 receptor. Why not interleukin 2? Because it does not have Ki in its term. It is not bevacizumab to call it an interleukin antibody. It is a bevacizumab. I hope this makes it clear. So di and bi, daclizumab, bevacizumab, interleukin 2 receptor, that is CD25, used in preventing transplant rejection. Okay. Next, bevacizumab is yes. What will be the answer to this? Very good, Adnan. It is anti-VEGF antibody. It is a anti-VEGF antibody. Against, very easy to answer this even if you have not read. So monoclonal antibody MAB, ZU tells you that it is humanized. Okay, it is not fully human, not chimeric, not mouse. It is humanized. CI tells you that it is cardiovascular. It is cardiovascular. Okay. And VEGF is your cardiovascular endothelial growth factor. So from cardiovascular or even from your VA, bevacizumab, you know that it is against VEGF. So remember, it is against VEGF. The other antibody against VEGF is It is your ranibizumab, which is against VEGF. Remember that. Okay. Now, you know that bevacizumab is against VEGF, but the question asked in one of the NEET exam is, bevacizumab is used in. So, even if you have not read this, you know that it is against VEGF. What do you think will be the answer to this? What do you think is answer? Yes, very good. It is diabetic. It is diabetic retinopathy. Okay. It is diabetic retinopathy. Why? How can I guess this question if I get this and I have not read this? So, bevacizumab is anti-VEGF, that is vascular endothelial growth factor. So, it prevents angiogenesis. And where do I see angiogenesis amongst all these conditions? I see it in diabetic retinopathy. So, we will use this in diabetic retinopathy to stop or prevent your neovascular macular degeneration in diabetic retinopathy. So, wherever you want to prevent angiogenesis, you will use bevacizumab. Okay. Kiruba was asking what is bevacizumab. I think people are giving the mnemonic for your bevacizumab के जैसा ही दूसरा ड्रग जो है वो है जैसे मैंने बोला रानी. ठीक है. So, bevacizumab, they go together. So, they are against VEGF. Very good mnemonic, people. We have already seen this. Monoclonal antibody causing cardiomyopathy is monoclonal antibody causing cardiomyopathy. We have already seen this is very good, Adnan, trastuzumab. So, can you trust her? Otherwise, she will break your heart. Heart is cardiomyopathy. So, trastuzumab against a previously asked NEET exam question. So, I think this was just a preview of the big list of monoclonal antibodies, your other drugs, which we will see in our one of the sessions at the revision course that we are running at Unacademy Plus. So, as I said, we do have an offer running for that, which is like you can get your entire revision course 1 month subscription for $999. You can use the code Dr. Nikita for that. Okay. So, in case you find any queries, how to subscribe to the course, you can write us, you can write in the comment box. Our team from Unacademy will get back to you, or you can go to the website Unacademy or app and you can write your queries in the intercom box. So I hope this helps you and gives you some tricks to remember the monoclonal antibodies. As I said, this is not the complete list, but these are the most important that we have seen. The rest of the monoclonal antibodies and newer drugs we will be seeing in one of our revision sessions in the revision course that I am taking. So thanks a ton guys for attending. Keep studying, keep revising and keep winning. Let's crack it. Thank you.